Okay, in this video I'm going to talk about hemorrhoids, starting by the definition of hemorrhoids. What is hemorrhoid? Hemorrhoid is a dilation of a varicose dilation of the anal and perianal venous plexus. So we have the anal and perianal veins that drain this area. If we have dilation in the anal and perianal venous plexus, then we will have hemorrhoids. Okay, what are the types of hemorrhoids? Actually, there are two types of hemorrhoids: the internal and the external. And the difference between these two types is the veins that affected by dilation. So let's assume that this is the anus and this is the anorectal line. Okay, imaginary line, anorectal line. Below this line we will have the external hemorrhoid. Okay, external hemorrhoid. And above this line we will have the internal, sorry for the bad font, hemorrhoids. Okay, so below the anorectal line we have external hemorrhoid, above the anorectal line we have the internal hemorrhoid. Okay, so what veins specifically are affected in internal hemorrhoid? The main vein that drains the this area above the anorectal line is the superior rectal vein. Superior rectal vein. Okay. Just write it like that. Superior rectal vein. Okay. The tributaries of the superior rectal vein is the internal rectal plexus. Let's assume that this is the anus. Okay, so this area will be internal and this one will be external. So it's by logic we can say that the internal venous plexus, tributaries, internal venous plexus will drain the internal area into the superior rectal vein and then into the portal vein, into the portal vein. So we have tributaries, the internal rectal vein tributaries. These internal rectal vein tributaries supply the superior rectal vein, and after that the portal vein with the other tributaries, of course, into the liver. Okay, into the liver. If we have a dilation in this plexus, in the internal venous plexus of the rectum, then we will have internal hemorrhoid. Okay, what about the external hemorrhoid? External hemorrhoid. The main vein that drains the area below the anorectal line is the inferior rectal vein. Above the anorectal line we said that the superior rectal vein is the main vein to drain. Below the anorectal line it is the inferior rectal vein. The question is what is the name of the tributaries of the inferior rectal vein. Okay, the tributaries of the inferior rectal vein is the external rectal veins. So the external rectal venous plexus, it drains into the inferior rectal vein, and the inferior rectal vein will drain into the systemic circulation, not the portal circulation like in superior rectal vein, but in the systemic circulation through what we call the pudendal vein. The pudendal vein. So let's review in a hurry. Here, the internal hemorrhoid is the dilation of the internal venous plexus, internal venous plexus that drains into the superior rectal vein that drains eventually in the portal circulation. The external hemorrhoid is the dilation of the external venous plexus that drains into the inferior rectal vein, and this inferior rectal vein drains into the pudendal vein into systemic circulation. Systemic circulation. Okay? So just remove this. Systemic circulation. This is different between the internal and external hemorrhoids. Okay? So now I want to warn you that the internal venous plexus is located in the submucosa of the rectum. You all know that we have the layers of the rectum and in the GI tract. We have the mucosa, we have the muscularis mucosa, and we have the submucosa, and then the serosa, okay, the final layer. The internal venous plexus is located into the submucosa, okay, into the submucosa. But the external venous plexus is located directly below the skin, okay? We have the skin, and directly below the skin we have the external venous plexus, and actually some of the plexus is in the mucosa, okay? This is an important point to differentiate between the internal and external hemorrhoids. We have many degrees of internal hemorrhoids, okay? What are these degrees? Initially, the hemorrhoids will not be protruded out of the anus. It will be contained in the anus. This is the first degree. First degree. The hemorrhoid is in the anus. There is no mass filled in the anus, in the anal area. Okay? In second degree hemorrhoids, there is a mass that protruded from the anus. But this mass is in and out, in and out, in and out. It protrudes and back spontaneously without any effort. You don't have to use your hand to reduce this mass. This is the second degree of hemorrhoid. The third degree, when the patient comes to you and say that I have a mass that is protruded with defecation and I can only reduce it with my hand. It is not reduced spontaneously. If I don't reduce it with my hand, it will not be reduced. This is the third degree. So the first degree, it is a mass in the anus. It is not out, okay? You will never feel the mass, okay? In the second degree, the mass is in and out. It is out and in spontaneously. You don't have to use your hand to make it back. in third degree, you have to use your hand to reduce the hemorrhoid. In the fourth degree hemorrhoids, it is not reduced. Okay, the mass is not reduced. Even when you use your hand, you can't reduce this mass, and this is the most dangerous or the most serious type of hemorrhoids. Okay, these are the types of hemorrhoids or the degrees of hemorrhoids. Important point to mention that the internal venous plexus is in communication with the external venous plexus. So we have a communication between the portal and the systemic circulation in this point. Okay, so internal venous plexus and external venous plexus is in communication. Okay, and this point will tell us that the internal hemorrhoids will eventually lead to external hemorrhoid. The most important cause of the external hemorrhoid is the diversion of the internal hemorrhoid into external hemorrhoid. Okay, this is important point to mention. Okay. Internal and external hemorrhoid. The internal hemorrhoid is the result of the dilation of the internal venous plexus, which drains into the superior rectal vein, which drains into the portal circulation. The external hemorrhoid is the result of a drainage dilation of the external venous plexus that drains into the inferior rectal vein and into the pudendal vein into the systemic circulation. Internal and the external. So what are the causes of the hemorrhoids? What are the causes of hemorrhoids? What causes the venous stasis in these veins? The internal and external venous plexus will cause hemorrhoids. Okay, so the question now is, what can cause the stasis in the internal and external venous plexus in the anal and perianal area? First of all, constipation. Constipation. How can constipation cause venous plexus and eventually hemorrhoid in the internal and external venous plexus? This can happen by the hard stool that results from constipation. The hard stool will push the veins in the anal and perianal area and will push the internal venous plexus and will lead to the stasis in the internal venous plexus and hemorrhoid as a result. This is the first cause, constipation. In addition to that, we will add pregnancy as an important cause of hemorrhoid. Pregnancy. How can pregnancy lead to hemorrhoid? The uterus will be bigger and bigger in pregnancy and will apply a force on the venous plexus and will lead eventually to internal and external hemorrhoid. And biologic, any mass in the rectum and in the anal area may lead to hemorrhoid. So cancer can cause hemorrhoid. An important and rare cause of hemorrhoid is the portal hypertension. As we said that internal venous plexus drains into the superior rectal vein, which drains into the portal vein eventually. If we have liver cirrhosis, the portal vein will have stasis, and as a result the superior rectal vein will have stasis, and as a result the internal rectal plexus will have